Hi, everyone. Welcome to this week's edition of Stanford Live. I'm excited to be meeting with our advanced practice team from the internal medicine side. To kick things off, I'm going to introduce one of the lead APPs, Nyssa, to get us started.
Thanks, Carly. Good afternoon, everyone, and welcome to our Stanford Live APP Inpatient Medicine event. My name is Nyssa El-Amin. I'm one of the co-leads for this service. I am a nurse practitioner by training. I've been a nurse practitioner for the past 12 years. I've worked in a variety of different settings, from primary care, palliative care, geriatrics, and now inpatient medicine. I joined Stanford in November of 2021, and I've been one of the leads on this team for almost the last 3 years. So excited to be here for the third time around to share why we love our service and the type of candidates that we're looking to recruit. I'm going to turn it over to my co-lead, Sam.
Hi, thanks, Nyssa. My name is Sam Sandhu. I'm a physician assistant. I've been practicing hospital medicine for the past 5 years. I did my PA school training in Ohio, worked my first job as a nocturnist PA for 4 years out there. I served as their co-lead for about 1.5 years before I sought a change and decided to relocate back to my home state of California. Saw that Stanford was looking for a co-lead, and it was the perfect opportunity for me to further my leadership skills, learn what a day shift hospitalist life is like. And I've been with the team for about 1 year, and it's been a wonderful journey. I'll pass the mic to Liz, our manager.
Hi, everybody. My name is Liz Fox. I am the manager for the Center of Advanced Practice, and one of the many teams I support is Med7. So really excited to interface with you all and as we look at filling these positions. Thanks, everyone.
Hi, I'm Elena. I am the talent acquisition representative that works with the inpatient team. So if you guys have any questions about how to apply or the interview process, just let me know.
Thanks so much, everyone, for those introductions. For everyone joining us today, any questions that you have for the team, feel free to drop them in the chat, whether you're on LinkedIn, Twitter, YouTube, Facebook, and our team will be so happy to answer those questions. We will also be talking about the openings, kind of just the overall department, the culture, what it's like work today, their day to day, why the team has stayed at Stanford for so long, what makes them get excited to come to work every day. So to get things kicked off, I'm going to pass it over to Nyssa.
Great. So I wanted to start by sharing a little bit of background about our team, how we started, and the progression over the last 4 years. So our service started in July of 2021. We started with 5 APPs and 1 lead at that time, and 2 collaborating physicians. It was a very small, tight-knit team, but we quickly realized that the needs of the hospital, our census was exploding. We were surging with all kinds of patients that we needed to expand our service. So we started to add on additional teams every couple of months. And at this point, we are at 25 advanced practice providers and 2 co-leads and over 12 collaborating physicians that are part of our service. So as you can see, we've rapidly expanded and grown in just a very short amount of time. Some of the things that are unique to our service is that we are an APP physician-only team. We don't have residents on our teams or fellows. We do interact with them and collaborate with them during our admission process, but that's one unique part of our service. We have physician assistant students that rotate on our service pretty regularly from the Stanford PA program. And that's just a great opportunity to interact with learners and to also share our expertise with students. The other thing that is a little bit unique about our service is that we work very closely with our physicians. So while you have your own list of patients and you're practicing very independently to your full scope, you have that great support from a physician. So we talk about our patients in the morning, we talk about them in the afternoon, we chat with each other throughout the day. There are teaching opportunities throughout the day. It's It's really a great team and service for those who are interested in ongoing learning and education. So we're, again, excited to be here to talk about the expansion of our program and to share a little bit more about our day today. I'm going to turn it back over to Carly.
Thanks, Nyssa. All right, well, then I'm going to put the spotlight on Sam. So Nyssa just talked about how the team has expanded. So what's the future of the team looking like? What gets you excited about where the direction of the team is headed?
Thanks, Carly. Yeah, I'd like to share a little bit about our day-to-day first, if that's okay. So what a day in our hospitalist APP life is like. So currently our shift roles are 7 a.m. to 7 p.m. So we expect our APPs to be in the house from 7 a.m. to 7 p.m. Coming in at 7, we are actually split up into teams of rounding teams and admitting teams. On any given day, we have 9 APPs on. And with that, there's teams set up, 5 teams. We use the Greek alphabet to designate our teams. So alpha, beta, gamma, delta, and epsilon. So most of our teams are rounding teams, and our delta team is our admitting team. So when you come in on a day, you may be assigned to a rounding team. You'll have your list of patients that you'll see. 6 to 8 is our target. So in the morning, you'll usually round a pre-round on your patients before you round with your attending. And each attending has their own style, whether that's table rounding or bedside rounding. And then we will do consultants. We'll reach out to our consults, place orders, and re-round with our physicians in the afternoon, and then work on our notes throughout the day. It's a very medically complex patient population that we deal with. So we're very much a challenging service, and it's a big learning opportunity for people. So where I see us headed from here is beyond our inpatient service day to day. We are expanding to our outpatient ambulatory service side, and I think that Nyssa can actually speak a little bit more about that.
Great. Thanks, Sam, for giving an overview of our day-to-day. We do have some very exciting new opportunities on our team that Sam and I are both looking to recruit additional members. Like Sam mentioned, we are starting a new program that is called Stanford Healthcare at Home, or Timely Discharge. For this program, it's a program that's focused on discharging patients from the inpatient setting 1 to 2 days earlier than their expected time, to help with opening up beds in the hospital and to also reduce length of stay. There's a set criteria for these patients. They will be more stable patients who may be just waiting on a couple of clinical things before they can go home. For example, they may just be waiting to see if their kidney function gets better so they can restart their blood pressure medicine. And so the purpose of this is going to be an APP mostly led program. They will do telemedicine visits post-discharge with this set of patients who meet this criteria. So we're excited because this is kind of bringing the hospital model outside of the hospital into the home. And it's a way for us to closely follow patients, hopefully reduce readmissions, and there's a lot of other metrics that we're excited to evaluate over time. Some other things that I'm excited about besides this new ambulatory program are more quality improvement projects on our team. We have a couple of members who have applied for PEP time, which is professional time that's set aside that they can spend on a particular topic that they are excited about. So, for example, one of my team members is interested in developing a patient acuity tool to help with measuring what is a good caseload of patients for a hospitalist APP. What kind of factors come in when we're talking about acuity for a patient, how sick they are, how critical they are. So this is one of many QI projects that are floating around on our team. There's also interest in artificial intelligence, or AI, which I know is a hot topic here in the hospital systems. So overall, we're just excited about not only expanding our team, but also thinking of more creative ways to interact with our patients outside of the hospital, and also ways to kind of measure the success of our APP programs.
That all sounds so exciting, Nyssa. And so much has changed since I talked to you guys last summer when we were doing this same streaming event. I want to give you guys a little bit of a break, though, and put Liz on the spot. Liz, we have such a great reputation, our Center for Advanced Practice. It's APP led. We have just some of the most phenomenal providers here at Stanford. Can you talk just a little bit about, just the Center for Advanced Practice and, why everyone wants to come here?
Yeah, absolutely. Thanks, Carly. So one unique aspect of Stanford is the Center for Advanced Practice, and we're under the leadership of Claire Kiriakis, who, if you've met her, interacted with her at conferences, is just a very dynamic leader. But we're very fortunate that the way we're structured, our professional practice is supported by the Center of Advanced Practice, and we're able to practice fully to the scope of our licenses. They really advocate for us within the domain of medical care, but also within the health system, creating opportunities for us as APPs to really be seen as leaders. Right now, this is crazy because when I joined Stanford a little over 9 years ago, we were about 300 APPs. Now we're 900 APPs strong throughout the entire health system. So really, it's an amazing growth of advanced practice at Stanford. Some unique programs that the Center for Advanced Practice houses. You heard Nyssa mention PEP, which is Professional Excellence Program. And that gives APPs actually dedicated time away from their clinical practice to work on academic endeavors, such as research, QI, lectures, conferences, abstracts, but again, carves out that time for them away from clinical to really fulfill their professional development needs. We also have a focused career ladder that is a rewards-based system, if you will, to be involved both internally as well as externally in your professional societies. We have shared leadership, which allows the frontline clinicians to really get involved in projects, again, throughout Stanford and with the Center for Advanced Practice. So just it's a really great organizational structure is how I would frame it to support you in your practice fully.
Thank you so much for that, Liz. Kind of want to circle back now between Sam and Nyssa. Sam, I'll let you go first. You've been at Stanford for a while. What makes you excited to come to work every day? Why do you get excited about this department, this job? For someone that is on the fence about applying for a role within the internal medicine department, what would you say to them about this is the next move that you want to do because here's why I love coming into work every day?
Thanks, Carly. Yeah, I think the reasons I love coming to work are the reasons why I joined the team to begin with. I think that Stanford has a reputation of its own. It's a prestigious institution, and the educational and learning opportunities are immense. It's such and CAP, the Center for Advanced Practice, is such a unique organization to work for and have as a support system. It really makes you feel like you're seen as an APP here, and you're not just a number amongst others. You're seen as an individual, and we really try to focus on individual skills that we can hone in on and help you grow as an individual and not just as a clinician.
Nyssa, I'm going to pass it over and ask you the same thing. What gets you excited about coming to work every day?
Thanks, Carly and Sam. I probably echo some of the same sentiments from Sam, but I was thinking about this the other day. What initially got me excited to come to Stanford were the leadership opportunities. I was mid-career and kind of looking for a more challenging, different focus than just clinical care. So I like the opportunities that the Center for Advanced Practice provides for leadership. What kind of keeps me here and keeps me excited to come to work is the expansion and growth and the team that we work with. We really do have a tight-knit group of APPs who come from so many different backgrounds. I'm constantly learning things from them and also our attendings that we work with every day. I really enjoy working with Liz and Sam. We make a great threesome team. And I really just want to say that Stanford is, again, one of the best places to work as an advanced practice provider because there's so many of us and because there is a great support system in place. So those are kind of the reasons why I love coming to work and why I stay.
That's always what you want to hear. So you guys have a couple of openings on your team, and you want those people to come join your team. So Sam, when you guys are looking at candidates that are applying, what are you looking for in your ideal candidate? What are you hoping that they can bring to the department? Just kind of, someone out there watching like, ooh, could this be the right role for me? What would you say to them about here's what we're looking for, whether it's personality, clinical experience, and then also once they move into your team, obviously you guys are leads. What's that career ladder look like for our APPs?
Thanks, Carly. Yeah, so we are actively recruiting for 3 positions at this time. Given that we've expanded over a shorter period of time, we have a huge team that's still trying to get to know each other. So what we're looking for is a person that's adaptable, who comes in with a personality that's willing to work well with others, from people from different backgrounds, diverse clinical backgrounds. We're also okay with, if you don't have experience, we have great educational opportunities and onboarding system in place. But of course, if you have experience, we love that. We love when people bring new ideas to our team and just help us grow. We are still very much in a growth phase. And I think it helps to have people that have worked in other places bring some new ideas, things that have worked well in the for them. And yeah, just really open-minded, lifelong learners. Obviously, coming to Stanford, you're an academic lover. So those are some of the things that we're looking for. And as far as career ladder goes, I think it's a very unique system that we have here for promotional levels. And I would hope to get some input from Liz on how career ladder works. Sorry, Liz, I think you're on mute.
Thank you. Sorry. Happy to talk about career ladder as a structural component, but also just a little bit as maybe you're a new grad working, looking at your first position and kind of what that career trajectory looks like. So from a career ladder standpoint, it is an application process throughout Stanford. So most new grads will come in at a level 1. If you're coming in with experience to Stanford, you may be considered for a level 2. But the application process is based on years of experience in your specialty, as well as contributions, both internally to Stanford as well as externally. So some internal contributions could be sitting on a variety of committees, working on QI, being a preceptor, giving lectures, things like that. There's quite a few other items within that bucket. The external contributions would be working with your national societies, being on a committee there, publishing, doing an abstract, working in research. Again, there's quite a bit of other categories there. But you fill out the application, you do a clinical exemplar to show your clinical expertise, and then you have some recommendation letters. And it actually goes in front of a committee of peer APPs. So there are some administrative support people on there. There's 2 directors that sit on that committee. But again, it's a peer of APPs to say, yes, we really feel based on the established criteria, this person either meets level 2, 3, or 4. Of course, there's a monetary compensation with it as well. But we're really happy. It's a unique privilege, a unique benefit that we have at Stanford. And as far as just talking about career ladder in general, the way I think about if I were a new grad, and it's been a while since I was a new grad, but the bonus of joining an established team like this is really the resources that Sam and Nyssa can bring. It's just not 2 leads. You have an amazing group of individuals. Several of them actually teach at the Stanford PA program. So I think an established team with just that resources can really benefit a new grad. I'll kick it back to Carly.
Thanks so much, Liz. Well, let's get into kind of the onboarding, the hiring, all of the things in order to get started with us. So Nyssa, I'm going to start it with you to talk about orientation, onboarding process, and then we'll pass it over to Elena to talk about how do you apply, what's the application and interview process look like, and then what are the benefits to working at Stanford. So Nyssa.
Great. Thanks, Carly. So to kind of go over a little bit on our onboarding and orientation process, I'll start by saying that we do accept new grads and experienced APPs on our team, and that the training will be a little bit different depending on your experience level. So most of our APPs are paired with an experienced APP on our team for all of their shifts. The time frame is usually around 6 to 8 weeks, depending again on your experience level. You'll start out with a smaller census of a couple of patients and start to build up week by week. You'll have feedback sessions with your lead, either myself or Sam, every 2 weeks. And that's when we kind of sit down with you and go over what you're hearing from the preceptors or the people that are training you, along with the physicians that you've worked with. It's also an opportunity for us to hear from that new APP, things that are working well, things that they would like to improve on, and to talk about their learning style so that we can make sure that we're meeting their needs as well. So once you finish all of your clinical shifts and get up to the target of 6 to 7 patients, then you're flying free solo, but you're not always by yourself. You still, again, will have the support of your APP colleagues on the team. There's oftentimes people have questions and they just might pose it to the workroom casually or in more formal ways, talking to the attending during teaching sessions. Some other resources that we've developed over the last year that Sam has worked on closely is developing educational models and series. This is new and it was well received by our team. We took a couple of bread and butter inpatient medicine topics and developed Zoom modules with a PowerPoint presentation that was done by our attendings on our team and also APPs on our team. So for example, we want to talk about diabetes management inpatient. We have a module that's recorded that we will require all of our new APPs to watch during their weeks of training. So this is just additional educational support. We also have hospital grand rounds, which is every week, which is part of the bigger section of hospital medicine as additional educational opportunities. I recently did a case study and paired up with another physician on our team to talk about a difficult case. And so these are other learning opportunities, not only for our new APPs, but for our existing team members. So as you can see, our onboarding process is pretty robust. You'll have a lot of support from different angles, and we are real excited to, of course, meet people who have different experiences to share with us.
Thank you so much, Nyssa. All right, Elena, tell us all of the benefits to working at Stanford and how these APPs can apply.
I gotta unmute myself too. Sorry about that. Yeah, so I'll start with application process and then I'll talk a little bit about the benefits. If you are interested in applying, there are a couple of ways that you can get in touch with us. We will have the link to apply, or at least the rec number to apply, in the comments, I believe, after this. So take a look at that afterwards. You can also connect with me on LinkedIn and message me directly if you want to ask any additional questions that you didn't get to ask here. Or if you just want to send your resume over to get the process started. Either of those are totally fine. And then once you submit your application, you and I will talk on the phone for a little bit. We'll go into a little bit more detail of the position. We also will discuss benefits, credentialing, all of those things before you move on to do a more formal phone interview with Nyssa and Sam. So once you are hired on, you'll go, like I said, go through the credentialing process. When you do start, you will go to a new employee orientation where they will talk in more detail about the benefits as well. But we do offer a really great set of benefits. I think we call it total rewards. So it includes CME, medical, vision, dental, a great retirement plan, great PTO policies. So if you have any questions about any of those, please let us know. We're happy to talk more about it. It also is on our careers page. So feel free to take a look at that. And again, just feel free to reach out with any questions.
Thanks so much, Elena. And for everyone watching, if you go into the caption, depending on what platform you're on, there will be a link to the actual job application itself. So go on, click, you can read through it. Elena's contact information will also be available, so you can reach out to her directly. But wanted to kind of circle back to the team again before we wrap up our Stanford Live today. One of the most asked questions I get when talking to anyone about working at Stanford is, what's the culture like? What's the team like that I'm going to be working with? Are there ways to connect outside of the hospital setting? Do they get together outside of the hospital setting? What do they do in the hospital setting? Do they celebrate, milestones? Do they, just how do they come together to be kind of that cohesive team that you love working with every day? So Nyssa, can you just tell me a little bit more about the culture of the internal medicine team?
Yes, happy to talk about the culture of our team. I think with any growing or expanding team, it's important to keep culture in mind and make sure that all the new people you bring on feel welcome, feel well received, and have some sort sense of belonging on the team. And I think Sam and I have done a couple of things over this last year to really focus on wellness and culture on our team. One is that we celebrate our medicine anniversary or birthday every year, and we have a picnic that's on site. Last year we had barbecue, we had music, people shared potluck, and it was just a really nice time for people to come together, share a meal, talk about how things had gone the last year. We also invite our attendings to that anniversary party every year. We do a retreat, which is an APP focused retreat. It's a team bonding retreat. And all of our APPs get the day off from their clinical responsibilities to attend this retreat. This last year, we had a great speaker from the Center for Advanced Practice who talked about belonging. And we had some fun activities like learning your personality traits and how that contributes to the culture of a team. And we closed with laser tag, which everyone enjoyed. We have a lot of competitive people on our team as well. Some other kind of things that are fun and happening on our team: people organize happy hours, hikes, running races, people travel together outside of the team. There are so many different opportunities to connect outside of our clinical work. And I would turn it over to Sam to see if she wants to add anything about our culture or anything that I may have missed.
Thanks, Nyssa. Yeah, we're a very fun group of people. I want to add that we also have a book club that's also with our attendings and APPs. So it's really nice to be able to read and discuss, literature that's not clinical and just learning more about our interests outside of work. So that's another big fun thing that we like to do. And our retreat day last year was one of my favorite days. I just think getting to know people outside of work just makes your day-to-day even better. I also want to highlight that we have 3 team rooms, and we're actively working on, we have some of our APPs on our team that are working on little projects to make our team rooms more personal. So one of the projects is that one of the rooms, there's pictures of all the Med 7 pets. So everyone's dogs and cats get to have a highlight moment, and people love seeing those pictures. And just anytime we have an event, we try to make sure we take pictures of our team and put them up in the room, just to highlight that we are more than just clinicians. We are humans and we are friends. So those are just some of the key things that I think that keep us together as a group.
And I'm going to also pass it over to Liz, and if she can speak on a couple of things as well.
Yeah, I would just highlight as well Stanford and CAP's commitment to APP wellness throughout the organization. I think Med7's culture is definitely one to highlight amongst the organization. But as CAP, we actually do every 3-year survey that looks at APP wellness and job retention, and that we're very strategic about how we respond to the survey. One program we have in place is actually Wellness Champions. So each team nominates an APP, and then they come together as a wellness champion group. But it's really decentralized in that then that team wellness champion works with their team in a budget to bring those wellness resources to individuals. So we've really done a lot with wellness and our Stanford retention rate. And I just love hearing all these activities from Sam and Nyssa.
I love that. Well, we're at the 30-minute mark. So I wanted to thank Nyssa, Sam, Liz, and Elena for coming and joining us today, telling us more about internal medicine. Hopefully it encouraged a couple of you to apply or at least reach out to Elena to learn more information. If I had my nurse practitioner or my physician's assistant, I would be applying. It just sounds like a great team. It just goes to show, the growth that we have here at Stanford. What a great opportunity, room for advancement. There's so much that goes on here at the Center for Advanced Practice. So definitely a great place for your next step in your career. But again, thank you to the team for joining us today. We hope you guys learned a lot, and we will see you next time.